So many women end up having to have a mastectomy to treat their breast cancer. And at that point, they'll be given lots of choices regarding their treatment. And one of these choices will be to have or not to have reconstruction. Many women do choose not to have reconstruction, and that's fine. It's entirely their choice, and there should be no pressure on them from family or relatives to have reconstruction. It's a very personal decision. Having said that, many women actually do prefer to have reconstruction because it makes them feel as though they're getting through the cancer stage and helps them recover. So I want to talk today about the options that women have with breast reconstruction. And really, you've got two options to consider in general. First is, are you going to have it immediately or delayed? And that means you can delay the reconstruction to some months or even years after your mastectomy. Women choose that sometimes because they want to get the cancer bit out of the way, and they want to make sure all the treatment's complete, and then they turn their mind to reconstruction. The other option is to have it immediately, and what that means is to have a mastectomy and reconstruction under the same anaesthetic at the same time. Obviously that prolongs the operation a bit, but it does mean you get both bits done in one go, and that's very attractive to some women because they don't want to keep coming in and out of hospital. So really, each person will make their own choice, each woman will make her own choice whether she wants immediate or delayed reconstruction. So the types of reconstruction are the second option, the major option that a woman should think about. By types, I mean, do you want to consider implant-based reconstruction, or do you want to use your own body's tissues? There is a hybrid where you use both, but that's not so much in vogue at the moment, although for some women it may be the preferred choice. Speak to your surgeon and they'll guide you. So when you choose an implant-based reconstruction, you're basically asking the surgeon to replace the volume of your breast tissue with the volume of a silicone breast implant. We know breast implants are safe. There are some potential complications and side effects with any operation, and your surgeon will talk you through the potential side effects of having a breast implant. There's always going to be some things to discuss and consider when choosing any option in medicine. So implants will replace your breast volume, and you can make a choice about the shape of the implant. Either you want a round implant or a teardrop shaped implant. The teardrop shaped implant kind of replicates the breast shape, whereas the round implant gives you a more full breast shape. Obviously, which one you choose depends on your body type, your preferences, what your other breast looks like. The other option that we mentioned at the beginning of this conversation is using your own body's tissues. Now, the preferred and probably the best way to use your own body's tissues is to take fat from the tummy area, which can provide some women with a bit of a tummy tuck. But that's not the reason why you should choose this. You should choose it because you want to consider autologous reconstruction. Autologous is the surgical name for using your own body tissue. The autologous reconstruction, or the DIEP reconstruction, is where the plastic surgery team will take fat from your abdomen, from your tummy area, and take it up to your mastectomy site and recreate your breast shape. It's a highly complex operation, requires microscopy and surgery put together, but it does avoid the use of silicone with breast implants, and some women choose that. The thing about the DIEP flap is that it can last a long time. The operation can last a long time, for example 4 to 6 hours, or if you're having both sides done, it can be even longer, 6 to 8 hours. And the recovery from the DIEP is slightly longer in a number of weeks. However, whichever operation you choose, either implants or reconstructions, you should remember what you're actually doing is making an investment for the rest of your life. So you want to pick the option that works best for you. And that might mean going for a DIEP flap and paying the price of a longer operation, longer recovery, or it might mean using an implant and not having that long operation, but recognising that implants at some point in the future will need replacing. These are all options that are open to women who choose to have reconstruction, and your surgical team and your breast care specialist nurse can talk you through all the ins and outs of each choice. And remember, you're always in control. I hope it goes well for you.